At the moment, only around 1% of our population in Africa has been vaccinated, yet we have a large number of people with COVID-19, millions of children still not at school because of lockdowns around Africa, and of course people unemployed because of lockdowns as well. Dr. John Nkengasong is the director at the Africa Centers for Disease Control. Doctor, good afternoon to you. I hate to say it, but it seems that we're falling quite quickly behind when it comes to vaccination. This means that our people are hugely at risk.
Indeed. I mean, the continent as a whole, as you rightly stated, has vaccinated just under 1.5% of its population. And if you recall, the head of states of our continent had agreed that a reasonable target to achieve herd immunity was 60% by 2022. So if you look at where we are today and you extrapolate that into where we have to be, I think then you can rightly conclude that we lag behind so much. And that is not a good place to be with respect to this fast-moving pandemic.
We need to produce more vaccines for ourselves. We have some coming from the factory in South Africa, in Gqeberha. Do we need a lot more sites producing a lot more vaccines? We need the sites, the factories here in Africa?
We import 99% of our vaccines and produce only 1% of the vaccines, and very broadly. So I think in order to sustain our ability to produce vaccines in the future of pandemics, we need to invest in the ecosystem that will enable us to produce vaccines more broadly, not just COVID vaccines, so that we can sustain the ability to produce vaccines when needed for pandemics. As we speak, South Africa, the Pasteur Institute in Senegal, the sites in Egypt, Morocco, and Tunisia do have that capacity to produce vaccines. However, they need to be supported more so that we can regionalize our ability to produce our own health security commodities, i.e. vaccines, diagnostics, and therapeutics. We cannot continue to rely on India and China to produce vaccines for the continent. That is not the most appropriate and sensible way to guarantee the health security of our continent.
I mean, obviously, when you talk about regionalization, it means governments need to work together, doesn't it? Governments and possibly pharmaceutical companies.
Yes, it is a partnership between the governments of our continent and the private sector. Governments will not do that alone, and the private sector will not do that alone. For example, we need to create the market, reshape the market for demand for vaccines on the continent, such that when companies produce vaccines, there is actually uptake of the vaccines at a continental level. I think that is extremely valuable. Otherwise, we would not sustain those companies that will jump into this space to manufacture vaccines. So it's a public-private partnership that is actually required there.
Do you think that everyone talks about the pandemic, although in some countries they talk about it less than perhaps we do in South Africa. Do you think leaders on our continent realize how important this is and how much we can actually do for ourselves here? I mean, if we become self-sufficient in vaccines, we could export them as well.
Absolutely. It's a competitive world, and we have to rely on our own abilities and capabilities. First of all, to meet our own continental demands, and then look forward to being competitive outside of the continent. There's nothing that China, India, Brazil are doing that we cannot do. You have right here in South Africa capabilities with groups like the Aspen pharmaceutical groups that are very capable of producing vaccines, enough vaccines across the continent, and also export them. I think that is what Africa should be projecting its might, which we have that capabilities, but need to harness them more so now, and actually use this advantage, use the opportunity rather of this pandemic to actually move that agenda forward.
We've got the World Trade Organization. They're looking at this waiver on the intellectual property for vaccines. Would that make a big difference?
That would make a big difference in the medium to long term. And we do applaud the decision of the United States government to provide a temporary waiver to that. We call on other countries in the West to do the same. We all want to be on the right side of history when the history of this pandemic will be written. So I think really it's encouraging to hear what what emerged from the Global Health Security Summit last week in Rome, where the European Union committed about $1.2 billion to supporting Africa's vaccine manufacturing effort. It aligns with the partnership we've launched called the Partnership for African Vaccine Manufacturing that was launched on April 13 by the African Union, chaired by His Excellency President Felix Tshisekedi, the President of the DRC. I think that those are all welcome initiatives there, but we call on others, especially the European countries, and other countries that have that ability to waive the waiver to do so that we can solve this global threat in a decisive manner.
So I think everyone would agree we need more vaccines. I can't see anyone saying that we should not make them here. Of course we should. The arguments might come around which vaccines, Doctor. So, for example, in Zimbabwe, right next to us, the Sinopharm vaccine, as I understand it, is being widely distributed. Some countries may look at the Sputnik V vaccine, the one from Russia. But we here in South Africa are using the Pfizer and the Johnson & Johnson vaccine. So what I'm saying is there might be a little bit of disagreement over which vaccine our factories should actually produce. Is there a way to sort of make sure we don't have those disagreements, some sort of common understanding we can come to first?
No, I agree. That is a very important question, and that is the unique role of the African Union and the Africa CDC that we are playing. I mean, if you recall, we did convene a meeting on April 12 and 13 of this year, where we brought all stakeholders together to discuss that issue and agreed on two things. One was the launch of a partnership for African vaccine manufacturing, and then second was a roadmap and a framework on how the continent should approach this in a stepwise manner, in a regional manner, and in a way that looks at an ecosystem as a whole, so that we actually ensure that there's value chain addition for vaccine production. That is the only way we are going to guarantee the vaccine security of our continent, such that countries can specialize and do certain things, and other countries can also specialize and do certain components of the vaccine. Vaccine manufacturing is not one product. It's a combination of products that are brought together to ensure that entity goes out into the human arm. So I think a coordinated approach is very important. And we are working on that with several countries that have expressed interest in that area.
So, I mean, there's obviously a lot to sort out here. One of the things around vaccines is most of them need to be stored very, very carefully. That makes transportation very, very difficult. It does mean that we actually need different manufacturing facilities in different parts of the continent with distribution routes. In other words, there need to be places with proper transport links that can get what's made to the rest of the continent.
So that is not a major concern for me. I can tell you that as we speak, several of our airlines have already adapted and are actually transporting vaccines, like the vaccines that are supplied through the COVAX facility, which is the mechanism put up in Geneva, supported by the WHO, CEPI, and Gavi. Ethiopian Airlines has a whole fleet of planes that can transport vaccines. Kenya Airlines the same. And I believe South African Airlines, some of the major airlines across the continent, are extremely now well adapted to move vaccines around. The most important question is to create a market for that. That has to be an African market. Listen, we, as I said earlier, we produce only 1% of our vaccines, import 99% of our vaccines, and consume 25% of the global vaccines. So I think that tells you that the market is here, and if we apply our minds rightly to it, and we should do so for our own health security reasons, we should be able to address the issues of both cold chain storage and transportation of vaccines on the continent.
Thereabouts, I think the numbers are around 1.2 billion people on our continent, Doctor. I mean, obviously that means that if we take children out of the picture, we have hundreds of millions of people that we need to vaccinate. We need to do it quickly. When do you think, I mean, in a perfect world, how long would it take us to actually build the factory and get things going? Would we be able to have vaccine doses coming off a production line, a new production line, in 5 to 6 months?
Not necessarily in Africa. What we need to do now is to really mobilize what I call the moral conscience of the world. to say that we have the tools that we need to win this battle against COVID-19, which is the availability of vaccines. We have vaccines sitting in warehouses in other parts of the world. The world needs to do the right thing and the courageous thing, which is to redistribute those vaccines. And that is why I applaud those countries that made announcements last week at the Global Health Security Summit with respect to releasing excess vaccines. We need those urgently. I mean, as you rightly said, there are three things we must do with COVID vaccination. One is fairness, second is speed, and third is scale. We need to do all three things simultaneously so that we can beat and break the backbone of this pandemic before 2022. If by 2022 ending, we've not vaccinated at scale, at speed, and with all fairness, then the risk is that we gradually move into an endemic situation where we'll be fighting this virus like we fight HIV, TB, and malaria. And that is not going to bode well for our health systems and for our own economic security and human security.
Dr. John Nkengasong, really appreciate the time. Thank you, Director of the African Centers for Disease Control, of course, talking about vaccinations there and the vaccine situation on our continent. Well,